Hello and welcome to the program. I'm Sophie Scott. Nursing homes are at risk of becoming hotspots for drug-resistant superbugs. The reason? Patients being prescribed antibiotics when they don't need them. A study in the Medical Journal of Australia says more than a third of nursing home residents may fall into that category, leaving them vulnerable to superbugs developing. To minimise the risk of developing drug-resistant superbugs, there are national guidelines on when antibiotics should be prescribed. A new report suggests that in nursing homes, that advice is being ignored.
Of the antibiotics that were prescribed to these residents, about 40% of them didn't have much in the way of symptoms and signs of infection.
The study found in nearly all cases of bronchitis, antibiotics were prescribed without proper testing. It found only a third of patients had samples taken to confirm they had an infection. Doctors are concerned that nursing homes will become a reservoir for multi-resistant organisms.
We probably use twice as many antibiotics in people as we need to. So this example in a nursing home just reinforces that view that we need to be much more careful with antibiotics. There's not new ones coming, so we have to preserve the ones we've got for as long as possible.
There are probably about 200,000 Australians that live in nursing homes, and if you multiply what we found in this relatively small study out to this population, that represents quite a lot of antibiotic use.
The Nursing Home Association wasn't available for comment. In addition, experts say the use of antibiotics in farmed animals needs to be reduced.
We can get this usage down markedly, and that has not only benefits to the animal industry, it has benefits to people because less resistant bacteria then come through the food chain.
Infectious diseases experts want an Australian Centre for Disease Control to better monitor the spread of superbugs. With Darwin becoming the nation's immigration detention capital, the Australian Medical Association says hospital services are being stretched to breaking point. Doctors say the hospital can't cope with sick and self-harming asylum seekers. They say the hospital needs more resources, but most of all, asylum seekers need to be moved out of detention. Jane Barden has the story.
Doctors say Royal Darwin Hospital is already struggling to treat the Northern Territory's disadvantaged Indigenous population, and it can't cope with up to 5 asylum seekers a day needing emergency treatment after self-harming or suffering from a detention-related stress illness.
And they put a huge burden onto what's already a very, very busy and under-resourced emergency department.
Some end up in the psychiatric ward.
Sometimes the degree of mental illness is such that it's become a psychiatric problem and that they do need admission to a psychiatric ward.
The federal government's been forced to provide 100 extra territory police to deal with detention centres.
What about ambulances? What about the hospital services? What about other services which are being provided?
The Territory Government is satisfied with the current arrangement of being paid by the Commonwealth for services rendered, but doctors say they've had no new resources and money wouldn't fix the problem anyway.
We can attempt to fix their symptoms but then send them straight back to the same situation which is causing their symptoms, to the same situation which is meaning that they need to keep taking these medications, all of which have side effects.
The federal government says detention centre staff are only giving drugs to detainees for legitimate clinical reasons, and it's working with the Territory Government and Royal Darwin Hospital to address emerging issues.
We need to get these people out. Time limits on detention would be the best way forward.
The federal government maintains it is working to get more asylum seekers out of detention on bridging visas and into the community.
There are warnings of a dangerous new strain of whooping cough resistant to current vaccinations. The disease is potentially fatal and the number of people contracting it has suddenly jumped. Australia's been in the grip of a whooping cough epidemic since 2008, and now new information has come to light about how a dangerous strain has taken hold.
What we've discovered is that the strains that we've been testing that have been collected in the past have changed in more recent years.
Last year, more than 38,000 diagnosed cases of the illness were reported, the highest level since records began in 1991. And more babies are ending up in hospital with whooping cough. The most recent victim was a 5-week-old baby boy who died in an Adelaide hospital. Researchers from the University of New South Wales analysed samples from Australian patients and found that the new strain now accounts for 84% of cases.
This study showed the mutation in one of the genes we found that actually associated with increased hospitalization rate.
Scientists think because the level of immunity from whooping cough is quite high, the bacteria has mutated to evade it.
The vaccines are no longer as effective as they used to be because the level of immunity is not as great initially, and it seems to wane more rapidly.
Researchers will work on new vaccines which might be able to stop this new strain. Until then, they warn that being immunised with the current vaccine is still the best defence against the illness. It's the holy grail of medicine, finding the formula for a longer, healthier life. Now the world's best scientists are in a race to discover why some people live into their 90s and beyond. And there's a $10 million bonus for the winner. Gwenny Gleeson is a fit and active 87-year-old.
I'd like to live as long as I can, as long as I'm healthy.
Scientists want to know why some people like Gwenny Gleeson can reach old age in good health. In a bid to unlock the secrets, scientists are being offered a $10 million prize to map the genes of 100 people who are over 100.
This is an incentive prize, a prize to encourage technology developers to create methods to sequence whole human genomes quickly, cheaply, and very, very accurately.
The competition will begin in January next year. Researchers will only have 30 days to sequence the genomes of 100 centenarians. Doctors will then compare the centenarians' DNA to those who have diseases.
Centenarians will be a great advantage because they may have some genes that are very perfect because they've avoided all the normal human diseases.
Scientists hope to isolate particular genes which are switched on in those people who live to 100 and develop medications which do the same thing.
Tremendously exciting, and it turns on its head our historical approach to drug discovery.
It means that sequencing DNA can be done not only for medical research, but can be used by patients.
You enter a completely different sphere of analysing complex information. And I really do believe that that's going to revolutionise medicine.
Gwenny Gleeson already knows the secret to ageing gracefully.
Yes, well, I have a glass of wine with my meals at night, and I think it's a great idea, great invention.
And researchers say it will help us understand not only what causes ageing, but hopefully how to prevent it as well. Medical experts are warning that Australia faces increasing shortages of essential hospital drugs and urgently needs a centralised emergency management system to ensure fair distribution. 3 senior medical bodies have written to the Therapeutic Goods Administration calling for an early warning system following the most recent scare when a critical cancer drug almost ran out. Margot O'Neill reports.
Australia's cancer specialists were shocked to receive an urgent warning from an international drug supplier that stocks of the widely used and essential chemotherapy drug doxorubicin would run out last week. The warning was as blunt as it was alarming. Alternative arrangements will need to be made for both new and ongoing patient treatments.
So it did come as a bit of a shock and left us grasping for ideas about what we might like to treat patients with if the worst did happen and the drug supply just completely dried up.
New supplies were eventually sourced and the crisis averted, but it's the latest in a string of shortages. Last September, it was injectable penicillin. Hospitals were forced to ration when stocks ran dangerously low. Medical experts say that in the past year, up to 90 drugs have run short.
Lateline was contacted today by a health professional who had a secret list of more than 30 drugs in short supply in a major New South Wales hospital right now. They included critical antibiotics, adrenaline, and some diabetic drugs.
Recently, over the last couple of months, more and more drugs are becoming unavailable.
For instance, intravenous labetalol, which is a very important drug for people who have an acute stroke and need to have their blood pressure measured, kept down low, that actually ran out and we had none left in the hospital and we had to use alternatives that we didn't feel very comfortable using.
It's part of a worldwide problem, with the United States now facing a chronic shortage of more than 200 drugs each year and rising. Most of them traditional essential medicines.
I think the drugs that are vulnerable to the Australian population are the more acute medications that are used within hospitals, particularly the injectable medications like chemotherapies, anaesthetic agents and intravenous antibiotics.
One reason, the rise of less profitable generic drugs and less factories making them. That's weakened and narrowed the international supply chain at a time of rising global demand. So that means if a factory closes, if a batch is contaminated, or if there's a natural disaster, international supplies get squeezed.
And because Australia imports most of its essential medicines and it's a relatively small market, it can get squeezed out. That's why some medical groups now want the federal government to step in.
The FDA in the US are very proactive.
Last week's crisis over the cancer drug doxorubicin is a case in point. Cancer clinics around the country were left in a mad scramble.
Individual hospitals will find out that there may be an issue with a particular drug, and some hospitals may not find out. And this is a process that is duplicated in every hospital around every major city, in every town across Australia. So it's a huge wasted effort, and quite often we all come out with a slightly different picture depending on who we've spoken to.
And because there's been no official notification that the crisis is over, some patients are still being denied doxorubicin today.
Yeah, I had a phone call this morning from an oncologist who wanted to prescribe doxorubicin for a patient, but was told there was none available. It makes me feel angry, especially when you put yourself in the place of a patient. A patient's being told that they may or may not get the best treatment for them on the basis of information that's incorrect.
Oncology experts, hospital pharmacists and cancer groups have now written to the Therapeutic Goods Administration, or the TGA, asking for a new centralised approach to future drug shortages, including an early warning system, national notification of relevant healthcare practitioners and legislation to ensure the supply and equitable distribution of essential medicines. A statement from the TGA said provisions already existed to ensure continuity of supply and to warn of stock shortages.
And that's all for this edition of the Health Quarter. Thanks for joining us. If you've got any story ideas or feedback, please get in touch on Facebook. Search for the Health Quarter page and click like if you want to be kept up to date. And I'll see you next time.